semimembranosus. Well, the name tells you that's more, when they go down the distal, looks like a more what? Membranous type. Okay. Proximal attachment, same thing, ischial tuberosity. Distal attachment, pay attention. Posterior part of the medial condyle of the tibia. Posterior part of medial condyle. Right here. Okay? Right here. And reflected attachment from oblique popliteal ligament to the lateral femoral condyle over there. But most important, you remember they are in the posterior part of the medial condyle of the tibia. All right? So, from here, right, over here. So this compared the semimembranosus. So semimembranosus inserted here, semitendinosus is what? Is inserted right here. Okay, so the proximal attachment pretty much the same. The distal attachment is different. Semimembranosus is more in the posterior, on the medial, superior, but posterior, okay, to the tibia. Now, the semitendinosus is the proximal but the medial side of the tibia. Okay, so these two muscles, if you get them together, actually, in terms of rotation of the leg, if you bend the knee, you rotate the leg, which one you think is more advantage to rotate? Definitely semitendinosus. They're more away from the axis of rotation, all right? So semimembranosus, yes, they can also internal rotate the tibia, but it's not as that advantage, easy to do it, all right? But the most important, they both keep extensor and knee flexor, all right? So the main action, extend the thigh, okay, the hip extensor, flex the leg, flex the knee, rotate it medially when the knee is flexed, all right? When the thigh and the leg are flexed, same thing, these muscles can extend the trunk, basically in the close to chin situation, all right? Innervation, same thing, tibial division of the sciatic nerve, L5, S1, and S2, all right? And arterial supply, pretty much same. Perforating branches of the profunda femoris artery, and the inferior gluteal artery, and the superior muscular branches of the popliteal arteries, all right? Lots of blood supply. So, these two, semitendinosus, semimembranosus, remember, okay, what's the similarity, what's the differences? All right, you need to know. And do not confuse semimembranosus with semitendinosus in terms of pes arterius. Okay, that two tendon, okay? I'm pretty much sure you can remember sartorius, gracilis, but sometimes you may have a problem with, well, is that a semitendinosus or semimembranosus? Oh, God, all right? So be aware of that.